you hear me? Hey!
Oh, jeez. Bamboo spine, bar brawls gone wrong, and an apple a day keeps the robber away? What? Today we're back at it, breaking down and reacting to all of the realistic medical scenes and wild injuries from The Good Doctor. All right, let's dive right in.
Family of 3 in a head-on collision. Another ambulance is behind us with the occupant of the other vehicle. Park here with me.
At least it looks appropriate. On this individual, you see a left lower extremity orange bag looking thing. It actually is a splint that has a foam in there that actually will form and just keep something in place and prevent it from moving around.
Ryan Liu, 40 years old, hypotensive in the field, GCS 10.
Everybody has this blue trash bag on. It's actually a gown to protect from blood. And then they're describing somebody who's hypotensive meaning that the blood pressure is low. GCS 10 Glasgow Coma Scale. It has to do with your best eye opening, your verbal, and movement.
Abdominal bruising.
Abdominal wall bruising, worry about internal bleeding, and especially with distension, meaning that the belly is tense and expanding. So there could be pooling blood into the abdomen. You could do a quick bedside ultrasound, something called a fast exam. You'll be able to see if there's blood in the abdomen.
I might be able to save his arm. I need a vascular clamp.
Elaine hit her head on the dash, GCS 15.
GCS 15 is the highest number. Typically, when you have a head injury, if there's vomiting, there is concern for a greater head injury that is lurking.
Vomited twice.
Elaine, I'm Dr. Glassman. How bad was your headache?
Really bad. Is my daughter okay?
She's strapped down to the board without a seat collar. Typically not a protocol that you would use. If somebody has a head injury, you're gonna put a seat collar on just because of the mechanism of action.
She was wearing her seatbelt. She has pain and bruising in her chest.
His spleens ruptured. He's got about 2 liters of blood in his abdomen.
What's going on with my dad?
I've done many fast ultrasound exams. You can't tell how much volume is in there just based on that. It's just a positive or negative finding. And if there's that much blood in the abdomen, there's internal bleeding, it needs to go to the operating room, it needs to be cut open.
Please don't talk.
Those doctors are taking care of it.
This girl has bruising to the chest because of the seatbelt. You worry about sternal fractures as well as any underlying pulmonary problems, as well as a heart contusion or a bruise to the heart.
She has decreased left-sided breath sounds. We need to insert a chest tube.
Why? What's wrong?
So decreased breath sounds on the left side with bruising to the chest wall, concern for a pneumothorax or hemothorax, and he wants to put a chest tube in. Typically somebody's stable and not significantly short of breath. You could do a quick chest x-ray, but sometimes if somebody's unstable, they have abnormal vital signs, you just put a chest tube in, unfortunately, given the mechanism and the high likelihood that there is a collapsed lung.
A broken rib punctured her lung. The pupil is dilated.
Subdural.
Elaine, you may have some bleeding around your brain. We're gonna have to take you to the OR.
A blown pupil, meaning very enlarged pupil, typically can occur for 2 reasons. Medication reaction, somebody might be born with it, it's called anisocoria, or increased intracranial pressure pushing on the nerves relating to the dilation of your eye or the constriction of your eye, which leads to this physical exam finding. You're going to get a CT scan of the head anyway, looking for a subdural or an epidural hematoma or interparenchymal bleeding, which is bleeding within the brain tissue.
You just need to... Oh!
His BP's tanking.
We gotta get him to the OR now.
BP tanking, meaning blood pressure is going significantly low, meaning he's pulling out more blood into his abdomen. Get to the operating room now. They'll actually skip imaging, not even worry about his leg at the moment because they know that he's pooling blood in the abdomen. If you don't fix that problem, he's going to die.
I will shoot your crazy I swear to God. Okay. Are you listening to me? I'll do it. Yes. Hey, you hear me? Hey!
Oh, jeez.
Oh my God.
Gunshot wound, left lower abdomen. Let's see what happens. Aluminum baseball bat, most likely to the face. It's going to break the jaw. Could increase the risk of intracranial bleeding as well as cervical fracture due to the whiplash injury. So now you have 2 patients.
20-year-old female, single gunshot wound to the abdomen, hypotensive and tachy.
Hypotensive, tachy, single gunshot wound to the abdomen. So all good things to hear from the pre-hospital setting so you know what you're dealing with. You also want to know, are they allergic to anything, any past medical history, something super quick. You can see that there's IV bag hanging. They're giving fluids to try to help with the blood pressure, but that's typically a sign of one of the first stages of shock where your blood pressure drops and your heart rate is up. Not good. They need to kind of move fast.
2 liters of saline en route.
Her name's Avery.
2 liters of saline already in. That already means that there is a 3rd one hanging. Typically at this stage, you probably start giving blood products.
We'll take good care of her. Jared, here with me. Blunt-force neck injury. Oxygen sats just dropped below 80. Trachea is crushed. I inserted a laryngeal mask, but the airway is not secured.
Are you okay? You weren't hurt?
This is the person that shot the young girl, and what I thought potentially, because of where he got hit, jaw, neck injury, but the bat even hit lower and injured the trachea according to his assessment.
His oropharyngeal anatomy is distorted for the contusion.
Subcutaneous emphysema. He's barely moving air. Let's take him to a bay. And get me an OR now.
Subcutaneous emphysema is a fancy medical word for air that is in your skin or in your tissue. And that's because there's trauma to the neck and the air is leaking out of the trachea going into the subcutaneous tissue.
I am a surgeon.
Oh, jeez. The way he fell, obviously it's a show, but you always worry about somebody falling on this type of tile floor and getting a skull fracture, cervical fracture, or intracranial bleeding. I love this about this show where they actually do these graphics and you can actually see anatomy and his thought process. Actually really cool. You're looking at the blood vessels of the brain using a different type of imaging called a CT scan, which they actually injected dye and then remapped out all the blood vessels, which is super cool. And then you're actually seeing an EKG lead, basically giving you the heart rhythm.
It's not rhabdo. You need immediate treatment.
What? For what? For what? For what?
Trampoline.
I can't tell what he's trying to say. Nobody is, because is he trying to say spleen, a trampoline, a traumatic spleen? Somebody who's passing out due to exertion in a bar typically could be related to an aneurysm in your brain, could be due to hypovolemia, so not enough blood to your brain. So you have to say, why are you passing out? A cardiac abnormality, cardiac arrhythmia, pretty much anything that would decrease the blood flow to your brain is why somebody would pass out. So then it's like, do you not have enough blood volume? Is there a rupture of a blood vessel somewhere? Or is there some sort of conductivity issue, meaning like your heart isn't pumping appropriately to then get blood to your brain? This is how you backpedal and try to figure out the problem. Have any of you ever passed out and had the full workup in the emergency department or had to go to a cardiologist's office? Let me know in the comments.
At 9, he led his team all the way to the divisionals.
Oh, whoa.
Spondylitis. Nasty little disease.
I wonder if they cut it off and was trying to say ankylosis spondylitis. Basically, the tendons start to calcify and cause significant amount of anatomical changes and structural changes of the spine and the back.
When Jeff was 10, the inflammation was so bad, the bones in his back started to fuse together into one big, gnarly bone.
There you go.
If you can't extend your back, you can't use your legs. If you can't unwind your back, you can't use your arms. Useless legs, useless arms, can't even fit into a standard wheelchair.
I've had breakfast in bed since I was 10.
I mean, that is trying to turn a negative into a positive.
And lunch. And dinner.
Are you in a lot of pain?
Not compared to what it was. I wish I met that rheumatologist at the Baltimore Spine Clinic 7 years earlier.
Rheumatologist is somebody that deals with autoimmune conditions and conditions of the musculoskeletal system with like inflammation. Now, if somebody's not getting up, moving around, your muscles are going to start to atrophy, specifically of the areas that you're not using. Atrophy meaning they're going to break down and get very skinny and not have good function.
They didn't offer you surgery?
I've been to 9 neurosurgeons and they all said that they couldn't fix me.
I'm going to need 2 residents to assist me with the surgery.
They're having like bedside conversation. We're doing this something called rounds. So you go and you discuss what's going on with the patient in front of the patient. Patient can weigh in, and it's also a way to update the patient at the same time. But the patient also appears to be quite willing. The Good Doctor is always entertaining. They talk about a lot of good medical topics that I wish everybody would watch this show, because you will learn so much by just watching it. They're pretty accurate. What other medical shows out there should I watch? Let me know in the comments. If you guys enjoyed this and you enjoyed the reaction, definitely check out this playlist right here. And make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.